Well, it is the start of sixth season, which means the viruses, common colds, COVID-19, they're all spreading. But that's not the only thing. There are nearly 2,000 measles cases across 43 states right now. Senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja, he joins us now. Doctor, wonderful to have you. So I wanted to start with South Carolina. This is serious. You have more than 250 people, including young students, quarantining. And for some of them, this is their second time. So measles, as you know, highly contagious. The virus can linger in the air for up to 2 hours after an infected person leaves a space. Is quarantining sufficient? And if not, what more needs to be done to slow the spread, especially state to state?
We've known since the 1960s what's needed to slow the spread of measles, and that's getting more people vaccinated. The reason this outbreak occurred, the reason these children are in quarantine, is because not enough people in South Carolina are vaccinated against measles. That's the try and true way to stop the spread of measles. So quarantine is going to help slow the spread, but ultimately, in order to remove this threat, you have to get the vaccination numbers up, or we will continue to see cases in South Carolina and cases in other states where people may travel to.
I hear you. So back in April, Health and Human Services Secretary Robert F. Kennedy Jr., he endorsed the MMR vaccine to combat measles. You still have some people out there hesitant. So do you hear pushback in your practice? Are there common themes to concerns? And how do you advise your patients?
Well, I tell people that the vaccines are basically the best type of technology that humans have invented when it comes to medicine, that these vaccines are tools to live in a world where there are infectious disease threats. And when we think about measles, the fact that we were able to eliminate it in the United States, it will likely be uneliminated in January when the World Health Organization convenes, was because of the vaccine rates. That's what was keeping it at bay. And you remove the vaccine and you have what we have now. Multiple outbreaks all around the country, individuals who have died of measles in the United States, which is really unheard of in the modern era. All of that's happening because there's no vaccine. And this is a safe and effective vaccine. It's been around since the 1960s. Measles should have been put to bed a long time ago, but for the fact that we don't have enough vaccination rates in the United States and around the world. So I tell people that this is something that's really valuable for their individual lives. Nobody wants to get measles. People get hospitalized. People get pneumonia. People have their immune system altered by this virus. It's not some benign thing that people have somehow imagined was part of their grandparents growing up or their great-parents growing up. If you can avoid it with a vaccine that's safe and effective, why not? And you can see the disruption that these outbreaks are causing all around the United States and how much resources are being devoted to stopping what are completely preventable outbreaks.
Well, I wish we could dive in more to some of those concerns, because obviously that's a compelling argument to be made, and you wonder what the thought process is on the other side, if there are any potential benefits or what people believe they're sacrificing in getting the vaccine. I want to move on, though, because the United States is on track to lose its measles elimination status by the end of next month, actually. This will be the first time in decades that has happened. So what are the greatest implications, as you see them, Doctor, of that reality?
It's an embarrassment. It's the United States sliding backwards. It's the United States going to an earlier era when measles was spreading more rampantly, when people were being hospitalized for measles. So it's when you think about societies that you think about forward progress, things getting better for people. This is clearly the opposite. And it shouldn't be happening in a country like the United States. This just happened in Canada, which itself is, that's also an embarrassment to have a country like that lose its elimination status. So this just really is a sign of the times that people are now turning away from this life-saving technology. And you often wonder, how did ancient Rome collapse? How did ancient Greece collapse? It's when people start turning away from reason and logic and technology and start hearkening for the Dark Ages. This is kind of, this isn't the Dark Ages, but this is how it happens. When people think, okay, we want to go back to an earlier era where measles was something that we all dealt with. And they're doing it not for any good reason. They're doing it just because now vaccines have become a political issue, a political symbol, and now part of people's tribal identity, and they don't want to get the vaccine, and this is the result.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.